Having a healthy mental health is important in the helping profession. However, there are workers mentally impacted while helping others, especially during the recent pandemic of the COVID-19. I held an informal interview through Twitter with a doctor who was working as a frontliner for the pandemic at a local hospital in the Philippines. I asked her if she knows anyone in the helping profession experiencing any mental health issues such as anxiety when treating COVID patients, and she responded that the anxiety mostly comes from selfish reasons such as what if we get infected or infect our family. She also mentioned some personal reasonings. Besides that, she also mentioned that the despair is also weighing heavily because we know that this is not ending anytime soon. We're running out of personal protective equipment. Everything we use is makeshift now, so the fear while interacting with patients is stronger and can lead us to make poor decisions. A podcast called Public Health on Call was held by Johns Hopkins Bloomberg School of Public Health, where they interviewed Dr. Albert Wu, co-director of RISE, which is Resilience in Stressful Events. A snippet of the podcast can be heard here. However, even without the pandemic, workers can still be mentally impacted. An informal interview was done through WhatsApp with an Indonesian doctor currently working in Germany, where she stated that she had always experienced distress every time she handled difficult cases in ER. She stated, "At the beginning of my career, I always have anxiety every time I was going to ER for night shift." When asked if it was because of the fear that the patients' lives depended on her, she responded, "It's fear of doing something wrong." She also said, "Death is always difficult even though I've experienced it a lot. Like for example, I was working in a hospital which mainly treated breast cancer patients. I knew some of them were at the end-stage disease and they were gonna die soon. Even though everyone knew that we couldn't do anything anymore, it was hard to deal with death of patients, because it's sad. The patient's family is sad. I don't know, anyone with empathy would also feel sad. And when I made a bad decision, I reflected on it even after the shift ends and felt like a failure and just cried even though it wasn't a fatal decision." She also stated that sometimes the specialists were unreachable at night because they were asleep, but then I needed quick response. This also contributed to anxiety and also one of the reasons why I hated night shifts.